Hello everyone, I'm Sabrina, licensed massage therapist and certified cosmetic surgery specialist, and this is Las Vegas Cosmetic Recovery. So today I want to talk about seromas. What is a seroma? How do you get a seroma? Why does it happen, right? So now, as I'm here in my office, I'm going to read you the definition of what a seroma is. A seroma is a collection of clear yellowish fluid that builds up under the skin, usually after surgery, creating a soft, puffy lump, often in the dead space left when tissue is removed. And while many resolve, large ones might need draining, aspiration to relieve pain or prevent infection. So now guys, when we're talking about what is a seroma when it comes to plastic surgery. Now with plastic surgery, generally when you get lipo done, or if you even have a tummy tuck, I've seen seromas in every single type of plastic surgery. Now, but let's talk about liposuction seromas. So when the doctor goes in there and he is sucking out the fat and he is taking out, and once he takes out the fat, you're left with kind of a, the skin and the muscle and then dead space. That's what the definition, as we're talking about the definition. Once they suck out the fat, you're going to see every lymphatic fluid is going to fill in that dead space area. And that's why it is so important to be getting the proper massages after you have plastic surgery, because what we do is we direct that fluid with manual lymphatic drainage in the beginning, and once we direct that fluid in the proper lymphatic channels, then that fluid will be directed properly. Now that being said, when the fluid is not being directed in the proper lymphatic channels, what happens is that if you're trying to force one quadrant to go to another quadrant with fluid, it gets stuck. When that fluid gets stuck, your lymphatic system is like, oh my God, I have to go down this way. So now once the fluid is trying to go down into the wrong quadrant, it builds and builds and builds and builds with a sack of fluid. Then you end up with a seroma. What happens when you get a seroma? Sometimes when they're little, I have created my own method to try to get rid of it without having to open incisions and without needing a needle to aspirate it, because I'm a massage therapist. I can't aspirate fluid. And I would never want to open up someone's incisions to drain them that way either. But that's for another video, which we'll put the link to in the bio to that one, if that has happened to you. So then now, when a seroma is formed, now you have this sack of fluid because your lymphatic system thinks, oh, I need to go down this way. I need to go down this way so that I can be drained, because that's where the lymph node is that I have to go to. But it's not, because someone did the wrong massages on you and now your lymphatic system is all jumbled and whatever. So now what ends up happening is that it fills with a fluid, right? A fluid bubble. So then it is best to go to a doctor or a licensed professional that knows how to aspirate the fluid. Now, sometimes when there is a very big seroma, you're going to need to go to a doctor. So now here in Nevada, and you know what? That's why I'm at my desk. Let's ask Gemini. Who is allowed to drain a seroma in America? So then at least we know for all the 50 states, guys. Okay, hey, look, and that's why I'm at my desk and that's why I have my computer, because I want to give you guys the proof. So in the United States, a seroma should only be drained by a qualified medical professional to avoid risks of infection, abscess formation, or injury to the deeper tissues. Okay? Now, so authorized professionals to drain a seroma: plastic surgeon, physician assistant, even a radiologist. I didn't know that. That's cool. Primary care provider. or a registered nurse. But a highly trained nurse may perform this, but is typically under direct supervision of an operating surgeon. Thank you, Google. Thank you, Gemini. So now this is why I'm doing this here, because I want proof and I want to tell you guys exactly what the proof is. If you are not anything of what I just listed, if you're a massage therapist, an esthetician, and you are using a syringe to drain a seroma, and I've seen this, and actually I'll post the clip right above here from Instagram of what I've seen. If you are a massage therapist who's using a syringe and poking a hole in someone and pushing fluid out of them, then you're not qualified to do that. But if you are doing that and you're not draining them or aspirating them with a needle like as it should be, you are directing the fluid in the improper lymphatic channels, and you shouldn't even be doing that to begin with. And if you're receiving that, then you need to rethink about your life choices and what you're doing and where you're going to. Now, on that note, what is a seroma? A seroma is an encapsulated or a pocket of fluid that becomes encapsulated and it has to be drained. So what is the way that you're going to fix it? You need to go to one of the professionals that I just listed so that they can drain it professionally and in a clean and sanitized environment. Now, once that is drained, it can come back. That is the biggest thing. If you have a seroma, it can possibly come back and refill with fluid. So if you're going out of state and you get a seroma and you go back to your state, it is very important that you find a doctor or a primary care provider, somebody that can drain that fluid, and then you can go back and re-see them. Because if you might need to have it drained a few times. Okay, guys? Now, that being said, what are ways that you can do to help having a seroma? Compression, compression, compression. So now you got to compress the heck out of it. You want your body to reabsorb that fluid so it doesn't come back. So this is when compression is absolutely important, especially if you do not have a doctor here that is going to help you get that fluid out properly. Now, why do you get a seroma? Is the question. Why does that happen? So a lot of the times when you get a seroma, it's because you got improper post-op massages done. How do I prove that? Watch the link in the bio for incisional drainage, guys, and what that is. But as always, like, share, subscribe, hit the push notifications for all things Las Vegas cosmetic recovery. Bye!